Welcome to Rainbow Kitty's channel for parents. Nurture emotionally healthy children with us.
How to support children having obsessive-compulsive disorder or OCD. Obsessive-compulsive disorder is an anxiety disorder that can happen in children and adults. It is characterized by obsessions which increase anxiety, and by compulsions which decrease anxiety temporarily. Obsessions are intrusive thoughts, ideas, images, or impulses that repeatedly enter a person's mind against their will. These generate anxiety and are difficult to dismiss. Compulsions or rituals are repetitive acts that are performed to reduce this anxiety, but the relief is only temporary. Engaging in these compulsions brings no pleasure. They are excessive and not realistically related to the problem they intend to fix. Later, the rituals may become more automatic and increase anxiety. Psychological theories of OCD suggest that ritualizing maintains the problem by preventing habituation to the anxiety and by not letting the child face their fears. Symptoms of OCD. Obsessive-compulsive disorder usually includes both obsessions and compulsions. But it is also possible to have only either of these symptoms. The child may or may not realize that their obsessions and compulsions are excessive or unreasonable, but they take up a great deal of time. They gradually start to interfere with their daily routine and thereby functioning in social or school settings. Now let us discuss some of the symptoms or themes of obsessions. Fear of contamination by bodily fluids, germs, dirt, or other substances. This can lead to repeated cleaning or washing of own body parts, surfaces, or objects. Some children may avoid crowds, handshakes, and touching common surfaces for fear of contracting germs. Some feel contaminated when ill-treated or criticized and may try to wash off this feeling. Another symptom might be intense focus on exactness or remembering things, orderly and symmetrical arrangements, etc. Doubting and having difficulty tolerating uncertainty could also be a symptom. Some children doubt whether the bag or school locker is closed or not. They may be concerned with getting a physical illness or disease while there are no symptoms. Some may have aggressive thoughts about losing control and harming self or others, being responsible for a catastrophic event, etc. Though the thoughts cause high distress, the child is unlikely to act in a way they fear. Some children might also have thoughts about shouting obscenities or acting inappropriately in public. Adolescents might have unwanted sexual thoughts, images, or impulses that involve children, or obsessions about aggressive sexual behavior towards others. Religious obsessions could be concerned with offending God, or with right, wrong, or morality. Besides, some children might also have superstitions about lucky and unlucky numbers. Now let us go on and discuss some of the symptoms or themes of compulsions. Washing and cleaning, including hand washing, brushing teeth, bathing very often and for prolonged hours due to fear of contamination, checking repeatedly for problems with toys, objects and appliances to prevent loss, damage, shock or fire. Besides, some children might check body for signs of illness. Spend time confirming the authenticity of memories. Meanwhile, there might be others who repeatedly check communication such as emails, for fear of having made a mistake or offending the recipient. Some children feel that they need to arrange objects in a certain order to avoid discomfort or harm. For example, they may repeatedly rearrange the books on a shelf. Counting and repeating routine activities, such as getting up from a chair or touching something a set number of times, are also possible signs. Another type of symptom could be mental compulsions, such as repeatedly reviewing an event to ensure that you have not harmed anyone in any way. Following strict routine could be a symptom too. Demanding reassurance from others could also be a sign. Hoarding is yet another symptom which involves a child feeling unable to throw away used or useless possessions. Another one is repeating actions with numerous successive occurrences. These are called tics. For instance, a child might reach out and touch something repeatedly or kick out with one leg and then the other. They will be able to suppress the actions for a while. This would further result in growing discomfort until it is relieved by performing the tic. No one knows the cause of tics. Stress and sleep deprivation seem to play a role in the occurrence and severity of motor tics. Severity of OCD. Obsessive-compulsive disorder can occur throughout the lifespan, and children as young as 6 or 7 often show OCD symptoms. Most adults with the disorder report onset in childhood or adolescence. Symptoms usually begin gradually and tend to vary in severity and themes throughout life. Besides, symptoms generally worsen with more stress. It can be mild to moderate symptoms or be so severe and time-consuming that it becomes disabling. Eventually, some children might drop out of school and adults might become housebound. If left untreated, it generally persists, yet effective treatments are available. Watch consecutive parts to know more about causes, risk factors, treatment options, related conditions, and support available for OCD. Links are in the description.
Like, share with your fellow parents and subscribe to get notified.